Hi, I'm Lucy DiCarlo. I'm the Community Outreach Manager for the Leukemia and Lymphoma Society of Canada in the Ontario Region chapter. I'll be giving a brief overview of the programs and services that we provide to the community. September is actually our awareness month. It is Blood Cancer Awareness Month, and it's an opportunity for us to share with the community the programs and services that we do provide so that they know that we're there and that they can reach out to us if there's a need for them to get that support. So thank you, and as we've said, I am the Community Outreach Manager, and I work in the province of Ontario supporting patients and families as they are struggling through a blood cancer diagnosis. And today I'm hoping to give you a quick overview of the programs and services we provide in the organization. So you may know this already, we are the largest voluntary health organization dedicated to blood cancer. We fund life-saving cancer research across Canada and provide free information and support services. Our mission is very clear: to cure leukemia, lymphoma, Hodgkin's disease, myeloma, and to improve the quality of life for patients and their families. So we're passionate about our mission because in Canada, over 100,000 people are living with or are in remission from a blood cancer. There are approximately 18,000 Canadians who will be diagnosed with a blood cancer in 2013. So on a minute basis, that's 1 every 28 minutes. There are 6,900 Canadians who will sadly die from a blood cancer this year. And overall, we don't know the stat why that is, but generally men are diagnosed more often or more frequently than women with a blood cancer. And leukemia and lymphoma accounts for almost half of childhood cancers. And so that's something that we try to support the families as they're going through their child's illness as well. So those of you that may know this, I'm not sure, Leukemia and Lymphoma Society has been through various recreations as an organization. We started in 1955, very much in Toronto by 5 individuals who were very concerned about the lack of programs and research available for leukemia patients. And over the years, I'm not going to read each year for you, but you can see that we've had various names and various focuses, leading eventually to the Leukemia Research Fund Canada becoming affiliated with the Leukemia and Lymphoma Society in the United States. And we officially changed our name in 2004 to the Leukemia and Lymphoma Society of Canada. We are our own charitable organization. We do have a strong affiliation with the LLS in the States. And we do have offices across the country now. We invest in blood cancer research. Over $26 million has been dedicated to blood cancer research since 1955. And we provide information and support services to patients, to families, and to caregivers, as well as to the healthcare teams who are working with these families at no cost at all. And we advocate nationally and internationally, as well as locally, to provide a quality of life for patients and their families. So again, I'm not going to read you the slide, but you can see that a large number, 56% of our dollars get spent on public education, and 23% there on patient support, and then 21% of the dollars raised go to research. So the great news is that patients are surviving longer and with a better quality of life. And so survival rates have doubled and or tripled in the last 40 years, which is very, very exciting. So again, this is just our research covers a great spectrum of the different types of research that's being done. We're funding basic research that studies biological abnormalities that cause cancer. We are supporting talented young investigators as they engage them in blood cancer research careers. We support early clinical trials of basic research discoveries that promise to become new and safe and effective treatments. And we bring together researchers from different disciplines working collaboratively to attack cancer from all angles and to create innovative treatments. So in fiscal year 2012, over $6 million was spent in research. And again, there's a breakdown there of the various types of grants that we were providing. So a couple of research, just a quick summaries for you. Targeted Accelerated Program is the TAP program. So we forge partnerships with universities and or biotechnical companies, bringing resources to them that they can more rapidly transform promising research into much needed therapies, and then including therapies that might otherwise go unfunded. Another branch of the research arm is the Translational Research Program. So we support outstanding investigations deemed by our expert advisors most likely to translate basic biomedical discoveries into new and safe and effective treatments, ultimately prolonging and enhancing patient lives. Our targeted therapies, here our funds have helped advance very successful targeted drugs such as Gleevec and Velcade and Dacogen, which are very common drugs used to treat leukemias. And also we help advance the related drugs Sprycel and Tasigna for leukemia patients for whom Gleevec wasn't a good enough match for them. And there's another drug called Kyprolis, which is also known as a very pharmaceutical name there. And it was recently approved for myeloma patients. So some of the researchers that we've partnered with are Dr. Ralph Steinman and Dr. Young in terms of just the Tcell discoveries that have displayed an artificial protein that physically deliver the immune T cells to cancer sites. It was a great discovery there. And antibody drugs and anti-cancer vaccines. Rituxan was the first antibody drug approved as a cancer therapy by the FDA, and it is used commonly to treat lymphoma and CLL, chronic lymphoma. So from a patient services side, we support patients by providing them information. Don't know what happened. Okay, so in terms of supporting patients, when we say we support patients, we're supporting the whole community around that patient. So we're supporting the individual, we're supporting their families, their caregivers, family, friends. The hospital healthcare teams sometimes call us and ask for our support as well, and the general public who are often engaged as well. So just a very quick summary. We have some programs. The First Connection program is a peer-to-peer volunteer program. And so often we are able to match somebody who's fighting a blood cancer with somebody who has successfully fought it, who has either been cured by it or is in remission, who is now available to share insight and support with others who are currently going through it. And because of our affiliation with the Leukemia and Lymphoma Society in the United States, we're able to find volunteers quite readily, if not in Canada, very much in the United States, and we're able to make that telephone connection with individuals. We provide, as an organization, educational programs to the public as well as to the healthcare professionals about blood cancers. We offer community resources. We have a back-to-school program where we collaborate with other agencies to integrate back a child who's been away from school because of a blood cancer back into the school community. And so we're supporting the teachers and the administrators, as well as the classmates, about the individuals coming back to school. And then we participate in things like health fairs or community events as well. Our Information Resource Center is a 1-800 number that's available North America wide, and that program very much is the go-to place. I always say to people, I'm not a healthcare professional myself, but when I get asked medical questions, I refer people to our 1-800 number, and daily there are people there that can answer everything from latest treatment options to clinical trials to anything that's health related. We have staff that are the experts in the field that can answer those questions for them. And we have a lot of educational materials. There's some on the back table. We have a catalog that's online as well as available to me. And we're happy to send resources out to individuals or to, again, other organizations that are working with patients and their families. And of course, our website is a wealth of information as well. I think I just zoomed through my whole presentation. So here you go. That's the First Connection program. So advocacy, we're very, very wanting to get more and more awareness about the challenges of blood cancer patients. So we are looking at trying to get more drugs on the formularies, trying to get more pressure, if you will, on the governments to fund the drugs that are sometimes quite costly for individuals as they're going through this. Just a side note here that only 3 drugs out of 24 that were approved in Canada were covered to some degree by the provincial formularies. And so that's a large amount of people that if you wanted to have a drug, you have to pay out of pocket for it, or if you're lucky enough to have extended health benefits, your companies will pay for it there. Almost 60% of the drugs had no government subsidized access in any province. And then just in terms of advocacy, so it's the drug approval, it's the going to the provincial and territorial bodies to add the drugs to the formularies and to get access to the new diagnostic tools, and helping patients and caregivers self-advocate for their own healthcare system, or their healthcare treatment, excuse me. So we are funded very much by our own fundraising. We do not receive any government or Cancer Society funding. We have fundraising methods that include general donations, in tribute giving, corporate gifts, partnerships, third-party events, and core campaigns. All the money that is raised in Canada stays in Canada. And so just 2 core programs that I'm going to talk to you about. One of them is our team and training program. It's the world's largest endurance sport training program. Participants raise money for LLSC, and then in return receive training to run or walk full or half marathons, or complete a triathlon, or a century ride, for example, and they have a destination weekend. So they'll go, I think they've been to Berlin, they've been to San Francisco, they go across the globe as a team of LLS supporters who are fundraising. Something that we do, again, North America wide, is a Light the Night campaign, and as September is our awareness month. And then in October, Light the Night, it turns to Light the Night. It's an event that brings together people who are, again, touched by a cancer. So we have people walking as patients and or survivors. We have people walking as supporters. And we have people walking to commemorate the loved one that they have lost. In Toronto, the first event is October 2nd. The one in Ottawa is October 19th, and then on London, Ontario, it's October 26th. So if you're available, please join us as an opportunity to light the night with our lanterns that are colored by the color of the person you're walking in tribute of. We have programs in our schools where we're working and educating our elementary students about blood cancers and having them have an opportunity to fundraise at a local level. And often that happens when there are students in the school that have been touched by blood cancer. So our vision for, by the end of 2015, that the majority of people diagnosed with a blood cancer will be cured or will be managing their illness with a high quality of life, that we have LLSC-led collaborations among the nonprofit, commercial, and government entities that will have created access to the most effective treatments and care, and that patients and their families and caregivers will have the support that they need for the best possible outcome for their specific cancers. And that's it. Are there any questions? Great, thank you.